Talking about now the terminal branches of the brachial plexus. We'll just start at the top here. The musculocutaneous nerve comes from the lateral cord. It pierces the coracobrachialis. It innervates it. It innervates the biceps brachii and brachialis, which sits in between the two. It then pops out laterally and terminates as a sensory nerve called the lateral antebrachial cutaneous nerve, which innervates the skin of the forearm here at the lateral forearm, but not the hand. The median nerve has a branch from both the lateral and medial cords. It, in the forearm, it innervates the pronator teres, the flexor carpi radialis, the flexor digitorum superficialis, palmaris longus. It sends a deep branch called the anterior interosseous nerve that innervates the flexor pollicis longus, the lateral half of the flexor digitorum profundus, and the the pronator quadratus. The median nerve then continues, enters through the hand through the carpal tunnel. It innervates the muscles of the thenar eminence and the lateral two lumbricals. Its sensory distribution is the palmar surface of the hand, including the palmar surface of the thumb, and the lateral 1, 2, 3.5 palmar fingers, as well as the dorsal distal half of 1, 2.5 digits 2, 3, and 4, and half of digit 4. The ulnar nerve comes from the medial cord. It dives behind the medial epicondyle and sits in the cubital tunnel. In the forearm, it innervates the flexor carpi ulnaris, half of the flexor digitorum profundus. It then enters the wrist via Guillaume's canal and it innervates the rest of the intrinsic muscles of the hand, including the hypothenar eminence, the medial two lumbricals, all of the interossei, and the adductor pollicis. Its sensory distribution is the palmar and dorsal part of the medial hand, including half of the fourth digit. Heading back up this way, the axillary nerve sits in the quadrangular space. It innervates the teres minor in the deltoid, and it terminates as a cutaneous branch of the upper lateral brachium called the upper lateral brachial cutaneous nerve. The radial nerve has a really wide sensory distribution in the arm. It dives posteriorly to wrap around the humerus and the radial groove, traveling with a deep brachial artery. Its sensory distribution is a posterior brachial cutaneous, a lower lateral brachial cutaneous, the posterior antebrachial cutaneous, and then the actual radial nerve itself pops out between the brachialis and brachioradialis and splits into the deep radial, superficial radial, and prior to doing that, it innervates the triceps and inconius. When it splits, the deep radial nerve pierces the supinator and innervates it. As soon as it pierces the supinator, it changes its name to the posterior interosseous nerve, which innervates all of the muscles in the posterior compartment of the forearm, all the extensor muscles, the extensor pollicis longus and brevis, the abductor pollicis longus. The superficial radial is strictly a sensory nerve that innervates the skin of the dorsal lateral hand and thumb.